This is now officially a pandemic. The World Health Organization confirmed today, although they declared it was not too late for countries to act, saying that they were ringing the alarm bell loud and clear. 196 people have died in Italy in one day alone, while the total deaths in the UK is now 8. The Chancellor has promised the NHS whatever resources it needs to cope, along with other measures to support affected industries and those in financial hardship. More on those budget measures in a moment. But first, here's our health and social care correspondent, Victoria McDonald.
This is what a pandemic looks like. The empty streets of Rome, an entire country in lockdown. This is what a pandemic looks like too. Hospital staff in full protection suits, patients breathing with the help of ventilators. Overnight, the number of people in Italy diagnosed with COVID-19 rose to more than 12,000, with more than 800 deaths. Flying in the face of what seemed increasingly obvious, the World Health Organization resisted declaring a COVID-19 pandemic for nearly 2 months. Today, that changed.
This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases. And we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear.
From the epicenter in Wuhan in China, it has spread and spread and spread again around the globe, this new form of coronavirus. And this is why it is now a pandemic. In the past 2 weeks, the number of cases outside China has increased 13-fold. The number of affected countries has tripled. More than 118,000 people have been infected, and 4,291 lives have been lost. Thousands more, the WHO said, are fighting for their lives in hospitals, and they expect to see those numbers climb even higher.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
A pandemic is declared when an infectious disease spreads easily from person to person in many parts of the world. Without a question, that is what has happened now.
Nothing will change for the UK response, but some countries where they have perhaps not taken the threat seriously enough and do not have in place pandemic plans or testing facilities or the capacity to isolate and treat in intensive care. It means that they need to really consider how they can do this. And in low and middle income countries, that can be quite tricky, and particularly because their healthcare systems are already stretched, and they will need some support and assistance, and international funding will be made available to them.
More than 90% of cases are still in just 4 countries: China, South Korea, Iran and Italy. In South Korea, they now believe they are past their peak and have been applauded for their speedy response. Their advice is to focus efforts on early testing. The WHO said that in Iran the situation is still serious, with a high number of deaths and sick people, and they called for global support for the clinical care of the infected. The UK saw a 22% rise in numbers from yesterday. All trusts in England have been told to identify areas now where they can treat infectious patients, and sources have told Channel 4 News that already some hospitals have cleared wards in preparation, and they are increasing the number of intensive care beds that can be opened. Identify cases, isolating them and contact tracing. That remains at the heart of the fight, but for how much longer? Tonight, the WHO said urgent and aggressive action is required by countries with significant outbreaks.
Victoria McDonald. Well, we're joined now from Geneva by Dr. Margaret Harris from the World Health Organization. Thanks for coming on the program on such a busy day, Dr. Harris. Just tell us very clearly what, by calling it a pandemic, would make or should make the global response to this any different.
Good evening. What this really means, and you're quite right to talk about us calling it, we're characterizing it as a pandemic. What this really means is we've gone from what we were saying for weeks, which is get ready, get your ventilators ready, get your staff ready. Now we're saying, take this really seriously. It's here. It's in your communities, but you still have a chance. And this is the unusual thing about this virus. You still have a chance to reverse it if you take the serious,
Right.
sustained, aggressive action to find every person who could be infected, find all the people who've been in contact with them, work with them, help them understand that it's to their benefit and, more importantly, to the benefit of the people they love, that they do self-isolate, they do quarantine to prevent onward spread.
But
and that
what-
we all, sorry.
No, sorry to interrupt. But what you're also saying quite clearly, and actually alarmingly, is that we haven't got ready enough. And we've had weeks of this now. You know, you've been warning about the effects of this. You've been talking about washing hands and, in some cases, self-isolation. We don't seem to have done enough. And is that why we're in this rather sorry state at the moment?
It's a very human characteristic to think, yeah, but it's not me, that it's somewhere else, it's somebody else, it's somebody else's problem. Now it's everybody's problem. And as I was about to say, the answer is in our hands. It sounds simple, the hand washing. I'm also talking about not touching your mouth, nose, and eyes, and thinking about the ways not to take hand to mouth, lots of different ways. And the other really important strategy, social distancing. So how can we limit the close physical contact, which is so much the norm? We've never lived more closely than we do now because we are, even though we're spread out,
Right.
we're so globalized, we're so close. We spend so much time actually in close physical contact.
And given that reality, does that not mean that countries where people are still going to schools and universities and restaurants and bars and museums should not be doing any of that?
Well, every country has an outbreak at a different stage. So the time when you can really stop it is when you've got a few cases in your community. And that's the moment when you identify absolutely everybody around them. You stop the transmission then. But you also really mobilize your entire community. You get everyone doing the hand washing, everyone paying attention to really good environmental hygiene, everyone understanding that might be a few cases, but stopping this thing is everybody's business. Right. And where we've seen that happen in places like Singapore, they haven't stopped it completely, but they've slowed it enough so they are not seeing this terrible situation where you've got hundreds of people in hospital and on ventilators, right, overloading the health system.
Given that, what you've just said about Singapore, should we here in the United Kingdom be locking down our cities?
Only if you get to a stage where you've got a really big sustained transmission in a particular community. So this is very much case by case. Now, you've got a big advantage. You've got a fantastic public health system. You've got very, very committed people. I've heard about people being mobilized. I've got friends and so on who are on the list, on the roster to come in and help. So you have actually made a lot of preparations. So you have got the advantage, but you still probably do need to persuade your community that this is serious. The time to do something about it is absolutely right now.
Okay, I keep pressing you for guidance because you're there and you know about this stuff. Should we shut down football matches? Should we shut down, the Cheltenham races taking place this week with tens of thousands of people watching horses, jump and gallop?
Certainly mass gatherings are a problem. They are an opportunity for people to come in close contact, especially if they have to queue or they're in a situation when they have to use public bathrooms and queue up. So when you organise a mass gathering, if you decide to go ahead, you have to do very intense risk assessment and work out how to avoid all the incidents, all the opportunities for people to be jammed together, not able to maintain the hygiene and the social distancing that does need to be maintained to protect everyone.
Okay, Dr. Margaret Harris at the WHO, thank you very much indeed. Let's go straight to Washington, D.C., where we'll find Dr. Jonathan Quick from the Duke Global Health Institute. Dr. Quick, thanks for coming on the program as well. I mean, what the World Health Organization has basically said is that China with its extraordinarily draconian measures, bought the world some time and that we've kind of squandered it. Do you agree with that?
No, I think two separate things are happening. I think that China has indeed done a superb job. I think what but in the rest of the world, I think there's been a strong response, but not strong enough. And the problem didn't just start in January. The problem, you don't prepare for a crisis like this in 4 weeks. And globally, we have been underinvesting in preparing. And we know it clearly. 6 months ago, the Economist Intelligence Unit, Johns Hopkins and NTI gave us our first map of the preparedness of 195 countries. And 4 out of 5 aren't prepared. And that's not a surprise. So I think we have to recognize that there's been this cycle of panic and neglect.
Okay, we live in a
After
different...
the first coronavirus broke out of China
Right.
In 2003, there was thousands of pages of reports, lots of promises, but we're still now almost 20 years later, not as prepared as we should be. Much more prepared than we were, but not as prepared as we should be.
Okay, this may be the wrong analogy, but you've written a lot about the Spanish flu of 1918, which killed more than 50 million people worldwide. Are there any mistakes that we should have learned, after the 1918 Spanish flu that we're committing again this time round?
Well, the key lessons that came out of that is the importance of leadership at all levels. And so I think early on, we didn't have leadership at the local level in China that let some stumbling happen. So that's one, and that needs to be everywhere. Messages from the top that are reassuring. There's some basic principles about be first, get the information out from government sources. Be credible, say what you know, say what you don't know yet, be empathetic.
Right.
So leadership.
Okay, are you getting...
And there are a couple of other lessons.
Right, so, sorry to interrupt. Are you getting that leadership in the United States? Because Donald Trump has been tweeting all sorts of contradictory things about this virus. Are you getting that leadership in a country that matters to all of us, the US?
Well, certainly we have the strongest public health system and CDC and the leadership in the health community, and I think those messages have been coming down clearly from people who are knowledgeable about epidemics and how to deal with those epidemics.
Okay, and just briefly, one final
we
one.
look for.
Go on. Sorry, do you think that...
Well,
do you think in the United States and in the United Kingdom, we should be doing what the Italians are doing now? Because if we're not careful, we're going to be like Italy in 2 weeks' time.
So here's the important thing. When you have no vaccine and you have no proven cure, you rely on public trust, understanding, trust, cooperation. And it has to be based on what's appropriate for the epidemic in that setting. If you call the alarm bell too early in a particular country and too often, when you do, people are going to say, it's them calling the alarm bell. So one of the principles is that each country, and in a big country, each state needs to make that risk assessment based on the realities there and then move quickly and decisively when it gets to the point where more decisive, more, as the Chinese would say, draconian action, more severe action is needed.
Okay.
It has to be based on the local risk assessment.
Okay. Dr. Jonathan Crick, got to leave it there. Thank you very much indeed for joining us.